Hi, everyone. Thank you for having me present today. So my presentation today is on navigating COVID-19 infection. My name is Rodrigo Sandoval, and I'm a third-year medical student, and I'm working with Dr. Golitsky. Hola a todos, gracias por dejarme dar una presentación para ustedes. Um, la presentación va a ser sobre la infección de COVID-19 y cómo navegar eso. Y yo me llamo Rodrigo Sandoval y soy un estudiante de medicina trabajando con la doctora Gorlitsky. Okay, so first I want to just do a brief little recap on how things are going with COVID. So I wanted to start a little bit of statistics. And so as of a couple days ago, cases have been soaring a lot. There have been about over 16 million total cases in the United States. Over 300,000 people have died here in the United States. In California, it's reached up to 1.6 million total cases, over 21,000 deaths, and just on the 13th, there were over 33,000 new cases. And even in just LA County, if you look over here, there have been over 500,000 cases, with almost 13,000 daily new cases and over 8,000 total deaths. And right here on these graphs, if you look on the right, the new cases and deaths below are just increasing in December. So if you look from March till now, they kind of went up a little bit of a spike in July, August. They went back down, but now they're back up. So this is definitely, a crucial time for everybody. Hola a todos, quería compartir unas estadísticas de los casos en Estados Unidos ahorita ha habido 16 millones casos en Estados Unidos y 300,000 muertes. 1.6 millones casos en California y 21,000 muertes. Y en la candida de Los Ángeles ha habido más de 500,000 casos y ha habido más de 12,000 casos cada día estos últimos días y sobre 8,000 muertes. Y si te fijas a la derecha, aquí si ves estos dibujos, enseña que los casos en California y las muertes está subiendo mucho en diciembre. Y es bien importante ahorita de poner atención en COVID y para todos protegerse. And so I want to do a little refresher on symptoms. So these are, one common symptoms that we see: fever, cough, sore throat, shortness of breath, headache, fatigue, body aches, loss of smell, taste, and GI issues, so stomach pain, nausea, vomiting. And not everybody's going to get all of these symptoms. Some people only get a fever, some people only get coughs, and it varies from person to person. And the thing with COVID is that it's very gradual. When somebody gets an infection, it can take anywhere from 2 to 14 days after the infection to get these symptoms. Excuse me. And some people are even asymptomatic, so they don't even get the symptoms. Hola, se quería recordar que estos son los síntomas de COVID, de la infección de COVID. So, fiebre, tos, dolor de la garganta, dificultad de respirar, dolor de cabeza, cansancio, dolores del cuerpo, pérdida de cómo saber o oler y problemas del estómago como náusea o vómito. Y la cosa de COVID, la infección, es que los síntomas pueden empezar de 2 a 14 días después de la infección. Y no todos tienen estos síntomas. A veces nomás es fiebre o tos y unas personas no tienen nada de síntomas. Eso es la cosa rara de esta infección. And so I just want to go over a few of the differences between the flu and COVID. So if you look at this table, they have a lot of similar symptoms and, fever, fatigue, cough, headache, runny nose. But the big difference is that in flu, you don't really see loss of taste or smell. You don't get many rashes or swollen eyes, but you do get this in COVID. And the other thing is that the flu, you get the symptoms right away, usually 1 to 4 days after the infection. But with COVID, like I said earlier, it can be anywhere from 2 to 14 days, usually about 5 days after, but it varies a lot. So aquí quería enseñar la diferencia de la influenza y COVID. So, tienen muchos síntomas que son parecidos, como fiebre, cansancio, tos, dolor de cabeza, pero la diferencia es que con la flu no hay pérdida de sabor o de aliento y tampoco tienen problemas de la piel o de los ojos, pero con la COVID sí. Y la otra cosa es que los síntomas con la flu empiezan luego, como 1 o 4 días después de la infección. Pero como dije antes, el COVID puede empezar después de 2 a 14 días y es más gradual. So I just want to remind everybody a few things to do to prevent infection. So you want to avoid large gatherings. You want to stay at home, be away from people, wear masks in public, keep washing your hands all the time, use disinfectant, wash your hands for over 20 seconds, limit contact to shared surfaces. And another big thing is to get the flu vaccine. This doesn't prevent COVID, but it can prevent any confusion if you start getting symptoms of cough or fever, anything like that. Because if you already have the vaccine, then you know it's not the flu. Then you'll be more sure that it might be COVID, for example. And, especially people that are high risk for the flu are also at high risk for COVID. So I think the vaccine is very important during this time. Quería recordarle a todos cosas para prevenir la infección de COVID. So, no ir a lugares donde hay mucha gente, tratar de quedarte en la casa lo más posible. Siempre usa una máscara, lávate las manos frecuentemente, más de 20 segundos. Usa cosas para limpiar, como donde tientan, mucha gente tienta las cosas, como las agarraderas de la puerta. Y una cosa bien importante es que agarres la vacuna de la gripa, de la flu. Y esto no va a prevenir COVID, pero es para que no se confundan si tienes síntomas, para que no se confundan si es flu o si es COVID. Y también gente que está a riesgo grande para el COVID también están a riesgo para la influenza. So queremos prevenir infección de cualquier cosa ahorita. And I just want to share a few of the high-risk groups. So people over 65, and then there are a lot of other comorbidities like cancer, kidney disease, COPD. So, that includes like emphysema, bronchitis, breathing problems, diabetes, heart conditions like heart failure, coronary artery disease, people who may be immunocompromised, and that can be from people who are undergoing chemotherapy, taking high-dose steroids, have had an organ transplant, or have HIV/AIDS. People who have a BMI over 30, so with obesity, have also shown a higher risk. People who are pregnant, sickle cell smoking, and a few other groups that are considered potentially high risk are asthma, people with high blood pressure, and cystic fibrosis. So estos grupos que aquí incluí yo son gente que están a riesgo más grande para infección más severa. Gente más grande de edad, más arriba de 65, con cáncer, problemas de los riñones, problemas de los pulmones, como COPD, diabetes, problemas del corazón, gente que tiene su sistema inmune bajo, por ejemplo, gente que tiene VIH, ha tenido trasplante de un órgano, está tomando quimioterapia, gente con obesidad, gente que está embarazada, gente que está fumando y otras enfermedades también como asma, alta presión, cístico fibrosis. And out of all these groups, I want to note that smoking is something that can be stopped. So, it's very important to stop smoking. Es importante de parar de fumar ahorita porque es algo que podemos prevenir. So now I want to jump over on things to do if you do get the COVID infection. And there's going to be a bunch of slides, so just bear with me on this section. So the first thing you want to do is, stay away from others. Don't go outside. You have to be in isolation, so stay at home. And if you do live with others, the important thing is to try to stay in one room. I know it can be kind of hard, especially if there aren't that many rooms or if there's only one room shared between two people. But the important thing is to try to isolate as much as possible. Try not to share items between household members. And you also want to let people know that you've had contact with, that you have the infection. So people that, you were in contact with before you were tested, let them know, because you want them to be as safe as possible. You want to keep wearing masks as much as possible, cover your coughs and sneezes, clean your hands often, clean and disinfect exposed surfaces repeatedly, and this even in your home, because you don't want other people in your household getting sick. Esa es la primera cosa de hacer si te enfermas de la infección de COVID. So, la primera cosa es estar separado de otra gente. So, por favor, quédense en tu hogar y hasta en el hogar, trata de quedarse en un propio cuarto. No quieres enfermar a otra gente que vive contigo. Y ya sé que es un poquito difícil porque a veces tienen que compartir un cuarto y no es posible estar en un cuarto, pero siempre trata de usar máscara hasta en tu hogar cuando hay otra gente. Cubre su boca cuando estornudes o cuando toses. Lava tus manos muchas veces seguidamente y siempre limpia cosas que tocas. Y también dile a la gente que vistes o que estabas en contacto antes que te diagnosticaron con COVID. So like I said before, you want to make sure to stay at home, and other things you want to do is you want to be in touch with your doctor, especially, if you have those comorbidities that I mentioned earlier that put you at higher risk. So you want to let them know of your symptoms. You want to avoid going outside and using public transportation. You don't want other people to get sick. And another thing that I read up about was that sometimes laying on your belly helps with symptoms. And this is because laying on your belly can help expand the lungs, breathe better, and remove lung secretions. So this can help if you're experiencing, difficulties with breathing, things like that. And you want to also monitor your symptoms, things like temperature. And if you have a pulse oximeter, that's also something you can measure. And the pulse oximeter measures oxygen saturation in your blood. So it measures how much oxygen is going to your tissue. And so, and this device right here, the picture, that's something that that is used to measure oximeter. You just put your finger in there for a few seconds and it tells you. And usually 95% and above oxygen saturation is reassuring. And for the fever, anything above 100.4 degrees Fahrenheit is considered a fever. And the important to note about the symptoms is to take note of how severe they are and to keep monitoring them every day to see if they're worsening. Because if your symptoms are worsening, I think that's you should contact your doctor, because that can be, we don't want you to put yourself at risk or, in danger. So, otras cosas a hacer en tu hogar es contactar a tu doctor. Dígale todos los síntomas que tienes, y si tienes esas enfermedades que estaba hablando antes, es más importante estar en contacto con tu doctor. No uses transportación pública para no enfermar a otra gente, y a veces es ayuda si te acuestas en tu estómago. Esto ayuda a que tus pulmones abran más y que puedas respirar mejor y que quites secretos de los pulmones. Y siempre quieres chequear tu temperatura, porque una fiebre es considerada temperatura arriba de 100.4. Hay esta cosita que se llama pulse oximeter, y esto te dice cuánto oxígeno está en tu sangre para tu cuerpo. Y con esta cosita te puede decir qué es el porcentaje de oxígeno. Y si es 95% para arriba, esa es una buena seña. Y quieres notar tus síntomas y tienes que notar si están empeorando, porque eso puede ser una razón por ir al hospital. So a few other recommendations for what to do when you're sick. So you want to make sure to drink plenty of fluids for hydration and get plenty of rest, especially with the fever. It's easy to get dehydrated. And also if you have any nausea or vomiting, that's another way you can lose fluid. And so you want to make sure that your body's properly hydrated. Tylenol, we recommend Tylenol mostly to reduce the fever. Taking 1 or 2 tablets of 325 milligrams every 6 hours helps with the fever and also with aches. And I know some people might like to use ibuprofen or naproxen, but we would recommend acetaminophen, which is Tylenol. And for sore throat and cough, you can manage that with hot teas, the lozenge, like the cough drops, decongestant balm, like vapor rub. And you can also use a cough syrup called guaifenesin. It's hard for me to pronounce, but you can buy that from the store without a prescription also. And also, it's important to have a big supply of food. You want to have at least a 30-day supply since you're in isolation and can't go outside. You want to make sure you have a lot of food at home, and you want to make sure to try to keep up proper nutrition. So have a lot of fruits, vegetables, proteins like eggs, frozen chicken, red beans, peanut butter, and a lot of grains like oatmeal, brown rice, pastas. A good idea could be buying, low sodium soup, canned foods, dry grains, things that won't go bad soon. And the thing with COVID is, I know when people get sick, you kind of lose an appetite. You don't really want to eat or drink, but it's important to eat and drink even when when you feel like it, and even when loss of taste and smell go away. Sometimes bland food helps with that. So eating, rice or pasta might be a little easier to eat when you have lost smell and taste. So that's a recommendation. So aquí hay más recomendaciones para qué hacer en tu hogar. So sigue tomando mucho líquido y descansa mucho para tu cuerpo. Y algo para bajar la fiebre es Tylenol y otro nombre es acetaminophen. Eso puedes tomar 1 o 2 pastillas de 325 miligramos cada 6 horas para la fiebre y también para el dolor del cuerpo. Y para la tos y para la garganta puedes tomar té, puedes tomar esos dulces para la tos y también puedes usar algo que se llama Vapor Rub para poder respirar mejor en tus narices, para abrir los sinos. Y también puedes comprar un líquido para la tos también, que puedes comprar en la tienda sin receta. Y también tienen se llama guaifenesin en la tienda, y también tienen para gente que es diabética, no tiene azúcar. Y de comida es muy importante tener mucha comida en tu hogar. Tratar de tener más de 30 días. Y trata de comer fruta, vegetales, mucha proteína como pollo, huevos, frijoles, nueces y también granos como arroz, pasta. Mucha comida que no se echa a perder rápido. Cosas de lata, sopa. Y ya sé, con infección del COVID, es fácil que no tengas ganas de comer o no quieras tomar agua o líquidos, pero es importante de seguir tomando para tener tu cuerpo sano. Y también otro síntoma es puedes perder el sentido de oler y de saber la comida, y eso no da ganas de comer, pero es importante comer cosas que son básicas como pasta o arroz. For high-risk groups, there are a few other recommendations. So these are the high-risk comorbidities that I talked about earlier, like diabetes, cancer, immunosuppressed. So you want to make sure that you keep taking the medications as indicated. So you don't stop any medication you have for high blood pressure, diabetes. Don't stop taking your asthma inhalers. These are very important for you to stay healthy. And make sure that you have at least 30 days supply of your medication. So if right now you are sick and you have only a few days left, make sure to contact your doctor to get a refill. And if you have any concerns whatsoever, contact your doctor about your health condition, about any comorbidities and steps to take. And if you don't have a doctor, contact a community health center or health department right away. Once again, for people who smoke, please stop smoking. Smoking increases your risk of more severe COVID infection. And if you've never smoked or quit before, don't start again. I know times are stressful, but it's very important to not start smoking at this time. And like I said before, the flu shot is very important. Otras consideraciones para gente que tiene riesgos altos es seguir tomando medicaciones como recetado. So, si tienes diabetes o alta presión, colesterol, lo que sea, sigue tomando esas medicaciones, no pares de tomarlas. Es importante tener, aunque sea 30 días de esas medicaciones para no ponerte a riesgo tu salud. Y contacta a tu doctor si tienes preocupaciones de cualquier clase de tu condición. Y si no tienes doctor, contacta a la comunidad, centros para ver dónde pueden ver. Y si fumas, por favor, para. Y si nunca has fumado o has fumado en el pasado, no empieces ahorita, porque fumar sube tu riesgo que tengas una infección de COVID más severo. Como dije antes, es importante agarrar la vacuna de la gripa. y no, y si tienes síntomas muy graves, ve al hospital de emergencia. So do not delay any emergent care if you have any of the warning signs. And I'm going to go over them in a couple slides. Ahorita voy a decir qué señas son bien peligrosas. So the last thing I want to do about what to do if you're sick at home is, you know, don't forget to pay attention to your mental health and well-being. You know, even though you're in isolation at your own home, please stay in contact with friends and family. It's very important so you don't feel isolated mentally, socially. Um, Ask people to check in on you regularly and ask somebody to be able to go to the store and pick up stuff for you, pick up food, supplies. If you have COVID, you know, it's important that you don't go out in public. Um, but it's important to still have food if you need it or supplies. So that's where it's important to have communication with somebody, you know, over phone and, you know, communicate with them about how your symptoms are doing. And if you ever need food or something for them to pick up, you can do so. And if you're at home, you know, it's important to distract yourself. Do anything you can, read a book, engage in crafts, paint, even watch TV, watch a movie, journal. Um, Try to avoid anything disturbing or even unreliable news information. So sometimes social media may have misinformation or may stress you out. Or if you look at how high the COVID rate is increasing, that might give you more anxiety and stress. So avoid those things. It's important for your mental well-being to, you know, to be better. Um, and if possible, if you feel well enough, you know, it's important to do light stretches, you know, to engage your body, do exercises that, you know, that for your muscles, like for range of motion, like move your arms around. It's important, you know, that you're not just still. Of course, rest up, but you know, do light stretches and exercises as neat as possible, and maybe do this with, you know, some cheerful music, and do whatever you can to keep your spirits up. I know this is a really hard time, but we're going to get through it, and you're going to get through this. I know it's really difficult, especially being in isolation in your room or in your house, not knowing what's going to happen or if your symptoms are going to get worse. But you know, this is why all these tips are here for, you know, so that, you know, you have people to talk to. Doctors are within reach if needed. Y esas son otras cosas de hacer si estás enfermo de COVID. So no pares de poner atención a tu salud mental y tu ser bien. Quédate en contacto con familia y amigos. Ya sé que tienes que estar en tu hogar si estás enfermo y no puedes salir, pero eso no quiere decir que no puedes hablar con amigos o familia por teléfono o por texto. Y es importante de pedirle a alguien que te chequee contigo, que te pregunte cómo estás haciendo todos los días, cómo están tus síntomas. Y también pídele a alguien que te ayude con comida o si ocupas cosas que puedan atraértelos a ti. Como no puedes ir en público, es importante que alguien pueda venir a tu casa y traerte cosas que necesites. Y también es importante distraerte y hacer actividades para que no sea tu mente nomás pensando en la infección, en COVID. So, lee libros, dibuja, ve tele, una película, cualquier cosa. Trata de no ver noticias que, que tienen mala información o que te pueden estresar y que o te pueden dar ansiedad. Es mejor cuidarte a ti mismo y estar más calmado o calmada. Y si tienes suficiente energía y te sientes bien, suficiente, haz ejercicios leves para no dejar, para que tu cuerpo se sienta mejor. So, mueve tus manos, un poquito de yoga, meditación y escucha música que es feliz con ese tiempo de celebración. Y trata de no dejar que tu pensamiento se vaya a lugares malos. Ya sé que ahorita es bien difícil, pero vamos a superarnos. Esto es una etapa bien difícil, pero vamos a salir más fuertes en el futuro. Y, y todas esas cosas que dije son importantes para que ayudarte. No dejes, no te quedes solo, habla con gente, contacta a tu doctor si tienes preocupaciones de todo. Okay, so I want to go over a few warning signs about the COVID infection. If And these warning signs, if you have any of them, seek emergency medical care immediately. Go to your local emergency room. And these are if you have a lot of trouble breathing, if you have any pressure in your chest, persistent pain in your chest, if you feel any confusion, like difficulty thinking, if you have difficulty waking up from sleep or staying awake, or if you notice that your lips or your face get blue, that could be a sign that you're not getting proper oxygen. So if you get any of these signs, go to the emergency room right away. And from there at the hospital, they can give you, even more intense treatment for you. Si tienes estos síntomas, ve a la emergencia luego, luego. Si tienes dificultad con respiración, dolor del pecho que no se va, si sientes confusión, problemas con pensamiento, no tienes dificultad levantándote o no te puedes quedar despierto, o si notas que tus labios están azules o tu cara se está haciendo más azul, eso puede también ser señal que no hay suficiente oxígeno yendo a tu cuerpo. Si tienes cualquiera de estas señas, ve a la emergencia luego, luego. No hay que esperar porque queremos prevenir algo más grave o muerte. The important thing is to prevent severe infection or even death. And here are a few things about how long to isolate for if you are infected or exposed. So if you tested positive but didn't have any symptoms, you want to stay in isolation in your home for 10 days after the positive test. If you were tested positive for COVID-19 and did have symptoms, so you want to be in isolation for at least 10 days after the symptoms started. And then for at least 24 hours of no fever. So, without taking any fever-reducing medication like Tylenol, it's okay to leave isolation once, your symptoms have improved and you don't have any fever. Certain symptoms, like loss of smell or taste, may last way longer than that. They might be it'll be gradual when they improve. So, for those symptoms, you don't need to be in isolation if you do have some lingering symptoms. But remember, even if you're not in isolation anymore, you still have to, maintain social distancing. You still need to wear your mask in public. You still need to wash your hands repeatedly, use hand sanitizer, stay home as much as possible. And if you have been exposed to somebody who was COVID positive and you're not sure if you were diagnosed or not, then it's important to stay home for at least 14 days. And that's, like I said before, it can take anywhere from 2 to 14 days for symptoms to appear. Of course, if you end up getting the COVID test and it's negative, then after about 7 days, you don't have to stay at home anymore. So, aquí quiero decir cuánto tiempo tienes que estar en tu hogar solo si estás infectado con COVID o si estabas en contacto con alguien que sí tenía positivo. So, si tú tuviste un examen positivo de COVID, pero no tuviste ningún síntoma, tienes que estar en tu hogar por 10 días después que tuviste ese examen. Si tienes la infección y también tienes síntomas, tienes que esperar aunque sea 10 días desde que empezaron los síntomas. Y tienes que esperar aunque sea 24 horas sin fiebre. Y ya cuando no tengas fiebre por un día completo y mejoraron tus otros síntomas, sí puedes salir de estar solo en tu cuarto, en tu casa. Pero te acuerdas que aunque ya no estás forzado en la casa, todavía usa máscara cuando vas afuera, no estés con gente en grupos, lávate las manos frecuentemente, haga todo posible para no infectarse otra vez. Y ciertos síntomas como cuando pierdes el olor o cómo saber la comida, eso dura más tiempo para regresar. Eso no te preocupes mucho si eso dura más tiempo para regresar. Y si te pusiste en contacto con alguien que tenía la infección, por favor, quédate en tu casa por 14 días. Esto es porque dura 2 a 14 días para los síntomas para aparecer. So I want to talk a little bit more about the COVID vaccine. So the vaccine that has become available and it's getting ready and it's been approved for use is the Pfizer BioNTech COVID-19 vaccine. And so I want to talk a little bit more about what this vaccine is. So this is an mRNA vaccine that works by providing our cells a template of producing a protein that our body can detect and destroy. And so we'll be able to make, and so this essentially allows our body to make cells to destroy the virus. Remember that this vaccine is not introducing the virus or any viral genetic material into our body. It's basically letting us know how to make cells to destroy that material so that when we do see them, our body does see the infection, we can destroy it. And so, we can become immune to from the illness. And it usually, after getting the vaccine, it will take a few weeks for our body to produce those T lymphocytes and B lymphocytes. Those are the cells that fight the virus. So it'll take a few weeks. So even if you do get the vaccine, you have to remember that you have to wait a few weeks before we can, be safe from infection. So currently right now in California, there are 3 phases in dispersing the vaccine because it's very limited right now. So then the first phase, first we're going to give it to critical populations. So these are healthcare workers, essential workers, people who work in like fast food, for example, and those people who are at very high risk of getting COVID-19. In phase 2 and 3, those are going to be dispersed to larger populations, once the vaccine is more available. And with this vaccine, it's going to be given in 2 doses. So the first time you get the vaccine, you're going to come back and get a second dose after 21 days. And currently right now, it's only going to be given to people 16 years of age and older. That's because all the research that has been done was only studied in people that were 16 years of age and older. We're still not sure how kids and teens under 16 respond to the vaccine. So we're not going to give them vaccine right now as at this time. Let me go back a little bit. So quiero hablar un poquito de la vacuna. So ahorita la vacuna que ya está aprobada para la gente ahorita se llama el Pfizer-BioNTech COVID-19 vaccine. Y quiero hablar un poquito más cómo sirve esta vacuna. So esta vacuna deja que nuestros cuerpos produzcan células que puedan pelear el virus. Esto no quiere decir que nos está introduciendo el virus o genes del virus. Eso no está pasando. Nomás nos está dando información para cómo producir células para pelear la infección. So, con esta vacuna vamos a poder estar inmunes contra el COVID-19 infección. Y cuando te den la vacuna, va a durar unas semanas para que nuestros cuerpos produzcan las células contra la infección. So no vamos a estar inmunes luego, va a durar unas semanas después de la vacuna. Y ahorita, en California, la vacuna la vamos a dar en 3 diferentes partes, porque hay bien poquita vacunas ahorita en ese tiempo. En la primera parte, nomás la vamos a dar a poblaciones críticas. So, gente que trabaja en salud, gente que trabaja en el hospital, en las clínicas, gente que trabaja como en lugares importantes como tiendas, como del correo, cosas así. Y también hay gente que tiene muchos riesgos contra el virus. En la parte 2 y 3, ya que esté más disponible la vacuna, la vamos a dar a todos los demás. Y la vacuna la vamos a dar en 2 diferentes dosis, separados entre 21 días. O cuando agarres la primera dosis, vas a agarrar la segunda en 21 días. Y esto es para garantizar que nuestro cuerpo pueda reproducir las células para pelear ese virus. Y ahorita nomás le vamos a dar las vacunas, nomás está aprobada para gente de 16 años de edad y arriba. Esto es porque los estudios que han hecho, nomás los han hecho en gente de 16 y para arriba. Ahorita no sabemos si sí sirve la vacuna en gente menos de 16 años. Pero ahorita están haciendo estudios. Vamos a saber, ojalá en el futuro, si sí también la podemos dar a chiquillos o no. So I want to continue by saying that this vaccine is safe and highly effective. So there was a study that included over 43,000 people. And in that study, half the people were given the vaccine and half the people were giving a placebo in which it doesn't do anything. And from the results, it showed that people who got the 2 different doses of the vaccine became immune to COVID, and it was 95% efficacious. So it means it worked really in preventing the symptoms and the infection. And of course, with the vaccine, symptoms and hospitalizations were reduced. So quiero hablar un poquito más de la vacuna, que la vacuna sí es bien efectiva. Y también hicieron un estudio de 43,000 personas. Y en ese estudio, a mitad de las personas le dieron la vacuna y la otra mitad le dieron algo que no hizo nada, nomás para comparar. Y los resultados de ese estudio enseñaron que la gente que agarró las 2 dosis de la vacuna estaba protegida contra el virus y era 95% efectivo. So eso bajó los síntomas del virus y también prevenió hospitalizaciones. And I want to talk a little bit more facts about the COVID-19 vaccine. So the vaccine will not give you COVID. The COVID-19 vaccine will not cause you to test positive during the viral tests. And people who have gotten sick before with the COVID-19 may still benefit from getting vaccinated. As we've seen before, people who have gotten the infection in the past, there have been some people who've gotten infected again. So if we give them the vaccine, the goal is to have them increase their immune response against the vaccine, and hopefully this will prevent future infection. And again, getting vaccinated will help prevent someone getting sick from the vaccine, and receiving the vaccine will not alter your DNA whatsoever. Son unas poquitas más cosas de la vacuna. So esta vacuna no te va a dar la infección de COVID-19. Esta vacuna no va a causar que el examen sea positivo cuando te hagan el examen de COVID. Y si te has enfermado de COVID en el pasado, todavía hay beneficio en agarrando la vacuna. Esto es porque hemos visto que varias gente en el pasado se ha infectado más de una vez con la infección. Y con la vacuna, el gol es que el cuerpo produzca las células para pelear el virus, y con la vacuna puede haber más protección. Y agarrando la vacuna puede prevenir enfermedad de COVID-19, y esto no va a afectar a tus genes o a tu DNA. No, esta vacuna no va a afectar nada permanente con tu cuerpo. Okay, and that is the end of the presentation. Does anybody have any questions right now?